So I'm Dr. Rob Backstein, plastic surgeon. I've been practicing plastic surgery for about 20 years now and have been working at TDC since it opened. And basically my role here is to do all the surgical procedures. So it's sort of an area of a lot of confusion and misconception amongst the public. What's covered and what's not covered is mandated by the Ministry of Health itself. It's not sort of a clinic or doctor-based decision. For especially bigger procedures, there may be a time where people need to be away from sort of more strenuous activities, including work if their job entails physical activities, and certainly like exercising and working out. Something to be aware of, and the main reason for that is more to do with putting strain on like stitching, for example, and causing stitches to pull apart. So that's a key point, and sometimes patients need to sort of prepare for that, with time off of work or middle of the summer and kind of fairly enthusiastic about playing sports and so on. It may not be the right time to remove lipoma that's on your shoulder blade area, because the healing of the procedure will interfere with your activities. So that's a big one, I would say. Aside from that, you just sort of basic kind of more common sense things, letting us know about any allergies, particularly to things like local anesthetics. The big majority of the procedures I do tend to involve stitching. The ones that don't tend to be very superficially based, small growths like a small mole on the skin or hemangioma. Some moles do need stitching based on their sort of anatomy. They extend deeply into the skin, and so they need a deeper cut, which should be stitched for like improving or optimizing scarring. In terms of dissolvable and not, there's a couple issues there. One is sort of relates back to the exercising and strenuous activity issue, which is opening of cuts. That's sort of a complication that a lot of patients don't really think about or know too much about, but it's a significant one, something that people need to be aware of. So one of the reasons to use a non-dissolvable stitch is basically because they're more durable. They're less likely, in higher risk areas, again, like the shoulder blade or the lower back, where like bending and lifting can kind of put tension or stress on incisions, less likely to have an opening problem. So for the most part, I use non-dissolvable stitches, both to decrease the chance of wounds opening, and also because of the notion, which I think there is some truth to, that they will tend to sort of heal quicker and potentially leave a better scar. It's an inconvenience often to come back, to have stitches removed, but it's a bigger inconvenience to have, a less than optimal scar, or certainly like if the wound opens, you're going to be coming in for many visits for wound care, etc. So much of that has to do with what was done. If it's something that just doesn't need stitches, for example, which as mentioned, is pretty rare in my practice. It could be as simple as treating like almost the equivalent of a minor abrasion or rug burn type of injury, which tends to be just keeping the area clean and using a little bit of polysporin or even Vaseline, and the wound just sort of heals on its own. When stitches are involved, it tends to be a little different. In the sense that there's initially some bandages called steri-strips applied. Steri-strips not only sort of cover the wound, but they sort of enhance the action of the stitches. They hold the wound together. They support the stitching. So they're usually left on for about 5 days, or until they sort of start to wear themselves off or fall off on their own. And then following that, we usually recommend just a simple polysporin bandage application. But as far as sort of other aspects of it, other than just bandaging, usually it's standard to keep areas dry for about 36 hours. I tend to sort of stray from that a little bit if the procedure is done in certain body areas like the underarm or the groin area, where I usually tell my patients, get in the shower sooner and just clean the area. I think overall that's a better approach than letting the area sort of sit for 48 or 72 hours. And just to stress it again, just to be aware of time off of work, time off of exercise. That's really a very common issue we run into here when the patients come in, that they're kind of taken a little bit aback by that part of the aftercare advice, and knowing about that is really useful, so you can plan around those instructions.